So you've been told that you have spinal stenosis, and it's a dreaded word, isn't it? What do we understand about spinal stenosis? What are the kinds of spinal stenosis that we need to be worried about? And what's normal and what should be more attended to quicker? In this video, I'm going to be looking at a very common condition that happens to a lot of elderly people with low back pain. And when they have a scan done, this is often one of the things that they worry about most, or is often actually reported as a diagnosis. So what is spinal stenosis? Now, spinal stenosis refers to a narrowing of the canal or the area where the nerves are. Now, in the back, you've got the spinal cord, which comes all the way from the top of your neck all the way down to the lower back, close to the tailbone. And throughout its entire journey, the spinal cord is enclosed in a canal that is formed by the spine and the various bones and the discs. Now, this canal over time is going to change in how wide it is, the diameter, and it's going to be narrowing with age. So fundamentally, there are three areas of spinal stenosis, meaning areas where the canal does become narrow with time. So if it happens in the neck, it's called cervical spinal stenosis. If it's in the chest area, that would be the thoracic spinal stenosis. And if it's in the lower back, it's called lumbar spinal stenosis. Since low back pain is the most common cause of back pain generally, spinal stenosis in the lumbar region is often the thing that we all look out for. There's another reason, but I'll come to that later. Now, within a particular area, whether it's cervical or spinal or thoracic or lumbar, at each level, there can be two different kinds of narrowing. I've told you that the spinal cord itself follows in the main canal, and that canal can get narrowed. So if it's the main canal itself that is getting narrowed, that's called a central canal stenosis. But at every level between each of the spine bones, two nerves would go out, one on either side, to different parts of the body. And like this, there are more than 30 such openings on each side, from your neck all the way down to the lower back. And each of these small holes through which the individual nerve roots come out, they also can get narrowed due to a variety of reasons. And that kind of narrowing is called foraminal stenosis. So people can have a component of central stenosis or foraminal stenosis at each level. Some of these will be related to age, arthritic changes in the facet joints, or a disc that is either bulging or thinned out. All of these are common reasons for foraminal narrowing or central canal stenosis. By far, the most worrying are when the central canal stenosis becomes significant enough that it starts to pinch upon the whole spinal cord. That is when we are worried that people can have symptoms like incontinence or the very worried word called cauda equina. But that's very, very rare. In my clinical practice of more than 20 years, I have only seen a few cauda equina coming to the clinic or to the hospital. It's something we are very worried about, and we do a scan lots more times than the diagnosis, but it is something to be aware of. Foraminal narrowing, meaning narrowing on one side or the other of one or more nerves, is more common, and that's what causes the typical sciatica-like symptoms we can experience in our hands or legs, and those are the ones that are more amenable to nerve blocks or injections. There are other reasons that you can have stenosis that comes along, especially when people have a twist in their spine due to age, a scoliosis, or due to a surgery or injury. But by and large, these are the kinds of narrowings that happen, and some of them are more amenable to injections. In some cases where the narrowing is very severe, surgery may be required. but not all of these narrowings necessarily result in pain. As I've said in so many of my videos, there is often no correlation between the intensity of pain someone has and the changes in structure that are seen on a scan. So always consult with your specialist and be aware of all the other factors that could be contributing to your pain when looking at spinal stenosis and related symptoms. I hope you found this video useful. I'll see you in the next video. Thank you. Thank you for watching the videos. I hope you're getting value from them. Don't forget to subscribe and hit the bell button for notifications on when the next videos are to be released.